також
Katarina. So let us begin with introduction of the current SPR Europe chapter president, Araya Tishby. If you could say a few words at the beginning. Thank you for being here with us.
Sure. First of all, I'm very, very happy to be here. I said in previous meetings that we have some things in common. I'm from Israel. It's not exactly the same war, but we have some common ideas, and we'll be presenting webinars on these topics in the next few weeks. So I wish good luck and to everyone, and enjoy.
Thank you, Araya. And I would also like to introduce Uli Kramer, who has been crucial in the development and support of this initiative. Hello, Uli, if I could ask you to also say a few words.
Yes. Hello, everyone. Good evening. This is the initiative SPR, originally from the European chapter of SPR when I was president, really more than 2 years ago. When we initiated this with Michal, and thank you for everyone for being here. It is SPR's way to stand with Ukraine, in particular in these moments of, when in the Northern Hemisphere, it's the shortest day and the coldest day of. So we need some light. And I think John Ogrodniczuk is the first person this evening to bring us some light into
Будь ласка, Міхал, я хочу звернутися також до тебе. Ти мене чуєш, да? Зараз я думаю, що дуже важливо всіх людей, які прийшли на цю лекцію, попередити, що вам надіслані запрошення, щоб ви заповнили анкету по дослідженням. Це зараз дуже важливо для нас, для України, щоб ми мали ці дослідження і щоб ми розуміли, що насправді в якому стані знаходяться наші психотерапевти. Ось, і перед тим, як почнеться лекція, я розумію, що, можливо, там в кінці це вже будуть враження від лекції, але зараз, поки ми ще такі настроєні по-діловому, хотіла б все ж таки запросити, Орая, можливо, тебе, тому що у тебе гарний зв'язок, трошки сказати про це дослідження, щоб зацікавити наших слухачів, щоб вони обов'язково зробили заповнили цю анкету.
Okay. What we were thinking about, and you correct me if I'm wrong, if I don't remember accurately, we were thinking of collecting data on the therapist experience, right, of working with people in psychotherapy. And I sent you, and we talked about different things we wanted to measure, and I sent you 2 questionnaires in English. They would probably need to be translated. One is called a competency scale, and it has different parts, and you can really take some parts out. You don't need to use the entire scale because there is no one single score. So there is a scale that talks about,
я вибачаюсь, ми його вже переклали, зробили, він готовий. І всі учасники, які тут присутні, його отримали, да, українською мовою.
So you're wonderful. You're very quick. Thank you. Okay, so the competency scale has parts like how well do I feel I'm managing a session? There are some items about that. How competent do I feel with certain skills? And how do I manage in difficult sessions when things are very, very difficult? So I think it really gives an overview of how well I feel I'm working. And the other one is something we discussed, self-compassion. Okay, a self-compassion scale, it's much shorter. To what extent can I take care of myself while I'm working with patients in such difficult times? Because I have to kind of take care of myself. Don't be too critical of myself if I'm not achieving results. so I can be open and relaxed in terms of meeting with clients. So these are two scales that are really important. We're also using them here. Okay? Thanks.
Yes, and this research
Так,
is done
дякую.
in
І я прочитала зараз інформацію, що насправді вони готові, і ви їх отримаєте після лекції. Зараз у вас їх ще немає, тому не шукайте. А ось після лекції ми вам їх надішлемо.
Wonderful.
And this research is done in cooperation with Society for Psychotherapy Research. So please feel invited to participate, and also we will greatly appreciate it as a form of cooperation between Ukrainians and the Society for Psychotherapy Research. Thank you. So now, without further ado, let me introduce our expert today, Professor John Ogrodniczuk, who is the director of the psychotherapy program at the Department of Psychiatry, Faculty of Medicine, University of British Columbia in Vancouver in Canada. He has done research in numerous areas, including narcissistic personality, alexithymia, but his most recent interest include specificity of psychotherapy of men, of male population. And now I'm giving the floor to you, John. Thank you kindly for being here with us today.
Well, thanks, Michal. I really appreciate this opportunity to be a part of an important conversation. So what I'm going to do is share my slides. How's that look? Can you see the slides well? Okay, fantastic. I'll apologize ahead if I do not get through all my slides. I've packed a lot in there. And I'll do my best to also not speak too fast to help with translation. When we're talking about men in psychotherapy, I think we first need to have a reflection on help seeking in men, how they actually get there, or sometimes, or very often really, how they don't get there. When we talk about men and asking for help, there's all sorts of comical commentary about men's reluctance not to ask for help, as illustrated in this cartoon. This guy is at the end of a culvert, far away from his desk at the factory, and he says, okay, if I can't find my way back to my cubicle in 2 more days, I'll definitely consider asking for help, illustrating the challenge that a lot of men have. And in fact, this comedic commentary is actually substantiated by research. There's actually evidence that guys tend to have pretty low help-seeking rates across a wide variety of contexts, including psychological help-seeking, which we know is fairly low. And it's important to clarify, it's not because men are more psychologically healthy. That's not it. And for a lot of guys, when they do, if they do end up looking for help, it's often in the context of a crisis. You know, something bad has happened and it's their last resort. And very importantly, when we talk about men and help seeking, we have to talk about masculine socialization. Now, this is really just a fancy label for how society teaches boys to be men, setting the parameters for what it means to be a man, the norms of manhood, if you will. And when you think about what those teachings are, there's a lot of do's and don'ts. So, for example, a real man is supposed to be tough and stoic, independent, self-reliant, in control of their emotions. And what they certainly don't do are show emotions, maybe except for anger. They don't expose any vulnerabilities, don't show weakness, don't ask for help or rely on others. And so when you take this all in as a whole, you can see the immense barriers this creates for a lot of men for reaching out for help when they want and need it. And as I mentioned just a moment ago, self-reliance is an aspect of masculine socialization. Real men sort things out themselves, so to speak. And we actually know that strongly adhering to this attitude of being self-reliant is related, not surprisingly, to low help seeking, but it goes beyond that. In Australia, a number of years ago, in 2017, you see there was a really large study looking at suicidality amongst men. And in this study, they included a lot of sort of the, oh, we got a view. Should I be paying attention to these messages that pop up? Okay, no, okay. In this Australian study, they looked at a lot of the sort of known robust risk factors for suicidality, and they included one other factor in there, and that was self-reliance. And after including or accounting for the effects of these other risk factors, they found that self-reliance was the #1 predictor of suicidality in men. And what we can reflect upon this is that guys who are overly self-reliant, they believe that they need to be strong in the face of any adversity, no matter how bad things are. They think that feeling down is actually a sign of weakness. It robs them of manhood, and thus they're unlikely to reach out to anybody, whether that's friends, family, professionals, for help. And an aspect of that self-reliance and masculine socialization is keeping stuff to yourself, concealing distress, don't show any weakness or vulnerability. And we know from a number of research studies we've done is that that's actually associated with lower likelihood of help seeking. Again, not surprising, but very concerningly, more severe symptoms of depression. And beyond that, we actually found that the effect of distress concealment on depression was actually mediated by two factors: not feeling understood by those around you and loneliness. So the more you conceal distress from others, the more you feel that people around you don't get you, the more lonely you are, and the more depressed you become. And so what this does, it exposes the conflict between adherence to the masculine norms, like distress concealment, and what men actually want and need: connection with others. And so when you think about, being self-reliant, concealing distress, I call it the Lone Ranger thing. This idea that cowboy in the the Wild West, and he's just on his own. But we know this isn't good for anybody. And certainly for men, what we've found is that those who are overly adherent to being self-reliant and concealing distress from the others, undoubtedly symptoms become more severe and chronic. More intensive treatments are required if and when help is actually sought. And unfortunately, there's actually an increased sense of embarrassment that guys actually have the longer they wait to look for help. And there's also a cost aspect. There's an increased cost to the public health system and to the individual as well. And sadly, there's a lot of men that will never look for help. They suffer in silence. Their problems grow. They become more entrenched, chronic. And for many men, very sadly, they look to death as their only escape from this pain. And in fact, globally, suicide is roughly 3 to 4 times higher among men relative to women. And it's actually one of the leading causes of death in men under the age of 50. And this is a pattern that's been entrenched for quite some time. And in fact, some authors from 1990 had summarized the situation in this way: women seek help, men die. Unfortunately, there's still some aspects of relevance to the situation today. It is changing, but certainly not fast enough. Another really important factor when it comes to help seeking amongst men is mental health literacy. And this is referring to what people know about things like depression and anxiety, and where to look for help and resources and support for those issues. And we know that men do tend to have rather poor mental health literacy with regard to things like depression and suicide, including low awareness of services and supports. And this low mental health literacy is associated not only with more negative attitudes about professional help, but lower intentions to ever seek help should they actually need it. And then you can't talk about barriers to help seeking without bringing up the critically important topic of stigma. Now, generally speaking, there's two aspects to stigma. There's social stigma and self-stigma. Social stigma is how we perceive others who may have a mental health challenge like depression. Self-stigma is how we see ourselves as somebody who has a mental health challenge. And so men, what's interesting in some of the research we've done is that we actually see social stigma decreasing. It's not in the sort of to the degree that we would like, but we actually see it decreasing. People are becoming more empathic and compassionate and supportive of people who are dealing with different mental health struggles. However, self-stigma remains stubbornly high. Somehow, men in particular, and they're not the only ones, but in this case, men in particular have a lot of difficulty taking that empathy and compassion that they have to others and turning it inward, exercising that for themselves. And so they do have a lot of embarrassment they report about seeking help. It hinders not only intentions, but the actual help seeking. It's just a really, really big feature that gets in the way for many men when they look for help or when they consider looking for help. One of the things that we wanted to do, so the studies I presented is us being, thinking we're really clever and we know what's getting in the way of guys. And so we create our studies and we have measures that we think tap into the constructs that we believe are important. And it's worked to an extent. Another way to get about it is actually asking guys what gets in the way. So here we did a study with 778 men. These are all men who said, yes, I am currently experiencing a mental health problem and I'm not getting treatment for it. So we asked them why. And so four factors stood out as commonly endorsed barriers, if you will. First one, guys were saying, a lot of people feel sad and down, kind of dismissing the importance of depression or the importance of the issue. So if I'm feeling depressed, a lot of people do it. It's not a big deal. I'm not special. I really don't have to do anything about that. Another one is getting at this mental health literacy aspect. I don't know what to look for in a therapist. Then self-reliance popped up. I need to solve my own problems. And then there's kind of a structural barrier there. I can't afford therapy. So you might assume that most, if not all, people who said, yeah, I have a mental health challenge and I'm not getting treatment would want treatment. But we actually found there's a significant minority of guys that said, I don't actually want treatment. So we're curious what might be predictive of that. And there were two things that really stood out. One, I wouldn't tell my doctor if I was feeling down or depressed. This distress concealment aspect. Second one, I need to solve my own problems. There, that self-reliance is rearing its head again. And then we just asked guys, like, tell us in your own words, what gets in the way of you reaching out for help? So this one was actually quite interesting and perhaps surprisingly not uncommon. Fear of implications toward life insurance coverage. This one's really quite touching. They don't feel that they deserve help or compassion. It feels like I must suffer. Social stigma. Not used to talking about my inner feelings or fearful of loss of privacy. And then Men are supposed to be strong and never need help, meaning that if I ask for help, I'm violating the masculine norms. I've become less manly if I do that. So if we talk about the flip side and say, okay, we got a relatively decent understanding of the different facets that get in the way of men getting help. But what about facilitators? There's been far less work done in this. And James Mihalik and Michael Addis, more than 20 years ago now, came up with this very interesting conceptual model about what is helpful for men getting help. And so everyone was saying, oh, that's a great model. We have a good understanding, but no one actually tested this model. So we did that, and we found that of the 5 features, there were 3 that really stood out for men who we surveyed about what helped them get help. 1, perceiving his problem as normal and common. And this wasn't in a dismissive kind of way. And it's like, oh, guys get depressed. I'm not different or weird or unusual some way. This is kind of a normal thing for guys. So it's okay if I ask for help. Seeing the problem as out of character, this ego dystonic thing. It's like, I'm not a depressed person. I don't like being like this. I want to change. And then very importantly for a lot of guys, thinking that asking for help doesn't mean that they're losing control. And for a lot of men, that was a really big thing. I need to feel like I'm still in control of me. And then another study we looked at, so guys that were in treatment for a mental health challenge, what are the things that they said were helpful? Having a positive attitude about help seeking, not surprising. Belief that professional help or professional support helps in recovery. Familiarity with mental health symptoms, mental health literacy, also relating to knowing how to access professional help. And then finally, having family members or friends that had sought help before, in a way kind of normalizing help seeking, but also being another source of information about how to find that help. And so if we think about it, it's like, okay, we know that help seeking is a challenge for a lot of men. We're developing better insights into some of the barriers, but also what can facilitate. And from this, there's been a lot of talk about how we need to reframe help seeking for men. So say focus on solutions and talk about the practical aspects like cost effectiveness, talking about rather than help seeking as being shaped around a sense of being broken or weak. It's actually something that takes a lot of strength, and it's a courageous action. And importantly, it's a team event. You're not alone. And in fact, you're the captain of the team. You're in control of your health. And part of this, as illustrated, as it requires us to slightly change our language when we're talking with men and mental health help seeking. It's about tackling the problem, teaming up, fighting stress or defeating depression. So something that can sort of engage them into really having a robust response to what they're feeling like. And it's like, I'm going to fight this. So that's talking about men and this pathway to engaging with help. And men are coming to treatment. And so one of the narratives that we've seen being repeated over and over, there's tons of speculation about, in one way or another, how men in general don't like therapy or counseling. But there's actually little evidence for this. And in fact, in several studies we've looked at, men, when you ask them in a speculative kind of way, so if you're looking at, or if you contemplate a future where you're experiencing a mental health challenge, how would you like to deal with that, if you will? And you give them a bunch of different options. Invariably, we find men by a very large margin, choosing therapy over things like medication or no treatment at all, taking a wait and see approach. And this pattern doesn't actually differ significantly from that of women. A lot of men are interested in therapy and are quite willing to consider going if they have the need. So what this might cause us to reflect on is that perhaps it's not new approaches that are needed for men, but how we engage with them once they do present for therapy might need some tweaking in order to help keep them there, keep them engaged, and to benefit. So when men come for therapy, it's not typical, at least in my experience, to say, you know, I'm here because I'm depressed or I'm anxious. More commonly, they refer more generally to stress. Now, in man speak, if you will, in the male parlance, stress is a euphemism for I've got some shit going on that I'm having a little trouble dealing with. And often they can isolate their stress to certain problems, whether that's something like anger, different kinds of behaviors like drinking too much, or specific situations like their relationship with their wife. And so here you can get a sense of the different kind of problems guys bring to therapy and will talk about in the context of stress. Another aspect of the male experience that is very common is shame. And I really like this quote from these authors. They said, being shamed by their peers as well as parents is how boys are taught to conform to male gender role norms. So in a way, boys learn to be men through shame. They learn to conform to these norms to avoid shame. So when a guy fails to live up to these internalized expectations of what a man should be, he experiences shame, which is often managed through ineffective and self-destructive strategies. And paradoxically, this actually increases feeling of inadequacy and leading to more problems like isolation and lack of support. So shame's a really big issue. Loneliness. Loneliness is rampant among men, yet it's something that they will rarely talk about explicitly. I'll give you an example on, we have a men's mental health resource called Heads Up Guys. And on this site, we had a stress test, a lot of common stressors that men experience. And we've had more than 200,000 men complete this. The number one most frequently endorsed stressor by more than 60% of men is loneliness. Loneliness is a big thing. It's pervasive. And it's exacerbated by societal norms that discourage men from developing emotional intimacy and vulnerability in close relationships. You know, they're supposed to prioritize independence and self-reliance, and not surprisingly, this gets in the way of them forming deep and more meaningful connections. And of course, we talk about the cultural norms of how men are supposed to be or not supposed to be. You think about different types of life transitions that men experience, like divorce or retirement, that can really have a strong impact with regard to that. You can see how their emotional restraint can get in the way of developing stronger bonds. And in a more contemporary way, thinking about how a lot of guys sort of become very invested in their device as a way that they think of forming connection, but it actually ends up exacerbating feelings of isolation. People do doom scrolling or make social comparisons and invariably end up feeling worse about themselves. Another big issue for men when they come to therapy is a lack of purpose or meaning in life. And when we think about it, this is really a critical issue. It's a cornerstone of all of our mental health. It provides us with a sense of direction for life, motivation, and even resilience. But a lot of men struggle with this, particularly during important life transitions or times where they feel like they've failed. You know, if you think about what it means to be a good, strong men are often feeling that they're judged based on their career success, their financial success, their role of providers. So if they feel that they don't meet these expectations, it can lead to a sense of a type of existential crisis for them. Disconnection from values. Men who have pursued sort of externally defined goals, big house, fancy car, vacation homes, whatever it is, big bank account, they end up finding themselves very unfulfilled, disconnected from their core values. Also, a lot of men feel that they don't really have a grasp on what their core values are, which is an issue unto itself. And then just the disconnection from others. Many of us find meaning through our relationships. And so if men aren't developing these meaningful relationships, they feel that their life is lacking meaning. And then we've got the issue of loss and grief. These authors from quite some time ago, it's still a great quote, and I use it all the time. Grief work is the core element in men's work because grief is the common denominator that ties men's experiences together. And we can think about the different types of losses that men experience throughout the lifespan. So, it starts with the loss of a maternal bond. There's different types of concrete losses like job and health, resources, relationship, and then even symbolic losses. So, for example, a loss of status or prestige and changes with employment. And it's really important to point out, it's not the losses in and of themselves that is the issue, but how men negotiate the sadness and grief associated with the loss. They very often have not been taught how to deal with these very difficult emotions. And so the losses stick with them and they compound upon each other. Connected to that, of course, is difficulties with emotions generally. And absolutely one of the most far-reaching consequences of masculine socialization is a disconnection or a lack of attunement that they have with their inner emotional world. A lot of guys will struggle with their emotions, being able to communicate their affective experiences to others and understanding the meaning that their feelings carry. What are these feelings? And for a lot of men, when asked to identify their feelings, they'll often try to logically deduce what they're supposed to say or feel rather than really looking inward about what their true feelings are. And the one exception tends to be anger, but even that is not often used in a nuanced way. It's like if I'm feeling distress of one sort or another, I'm angry, because that's the only one that kind of know how to talk about. So if you think about this in a more simplified way, thinking about how these constrictive masculine norms impact men's emotional lives. So very early in life, what is the common messaging that boys get? Well, boys don't cry, suck it up, push it down, grow some balls. There's all sorts of things like don't feel. And so what happens? They learn to distance themselves from their emotion. They lose touch with their feelings, what they are and what they mean. And thus, not surprisingly, there's impaired emotion regulation that occurs because of it. And so there's just this cascade of events that lead to more negative consequences, really. And let's think about the context of this talk that we're having right now, special considerations for men in Ukraine. And, with the war that's being waged by Russia against Ukraine, men in society are confronted with a lot of difficulties. And I've sort of compartmentalized different considerations of men in society and the challenges that they're facing. And these aren't mutually exclusive, but it gives you a sense of what men in the different layers of society right now might be confronted with. Very importantly, the men who are fighting in the war, PTSD, undoubtedly, I do a lot of work with soldiers, not in Ukraine, but soldiers from Canada who have been in different combat settings. And one thing that almost all of them talk about is this kind of moral injury or soul death. A part of them has died that they can never see coming back. I've seen things, I've done things, I am fundamentally changed. There's an aspect of survivor's guilt. How did I survive when my mates have not? And even the terrible physical injuries that they occur. Then there's men who fear being conscripted, the anxiety and dread that that might have for them. Those who aren't eligible to fight, sort of the inadequacy or guilt that they may feel. Still others who are hiding from enlistment. And so the fear and the shame and the sort of the moral conflict that they experience through that. And then men who are part of society, who are there contributing to society still functioning, and just generally the stress and anxiety and perhaps even the guilt and compassion fatigue. So you can see how many layers of challenges and difficulties men are confronted with there. And as help providers, what we need to be attuned to when we're working with them. And so on that note, working with men in therapy, as I said, for the most part, therapy isn't going to be fundamentally different than what you used to. What it really comes down to is appreciating the effect that masculine socialization has on men. So thinking about its impact on the act of help seeking. So if someone's actually come through your door to see you, so the different challenges he had to negotiate to actually be there. Its impact on his emotional awareness and regulation. Even the fact of being in a helping relationship with you as the therapist, its effect on intimacy and disclosure, how that's going to work. And a lot of guys' kind of tendency toward engaging in sort of concrete problem solving. And that undoubtedly will have an effect on therapy. And then we must be attuned to some of these common issues that men experience, and then consider using a slightly different style. Before I get into some of those nuances, it's important to think about some basic working principles. Again, just reiterating what you already know, core principles like empathy and acceptance and building hope, critically important, just like with anyone. Communicating respect and interest. Importantly, don't assume that you know a client just because he's a man. Every man, every human being is unique with their own distinct personality, with their own story. And really also being aware of what our own limitations are and accepting the fact that we can't help everyone who walks through our doors. And sometimes partnerships don't work. We need to acknowledge that for ourselves. So when a man comes in and getting started, I sort of just jump right in. And it's like, and I'll literally say, so what brings you in? It's like, why are you here? And that helps them sort of jump into action, if you will. And so you try to connect with whatever they brought in. And often it's, an example here is quite common. My wife told me I had to come. I don't really want to be here, but I was told I need to be here or else. And so you try to work with this, and it's like, okay, you came, so you must want to preserve your marriage. And so you probably want to figure out what you can do about that, right? And so you get to the motivation for why he's there, and then you try to build upon that. You think about his goals and expectations. What do you hope to get out of this? And it's like, okay, your wife told you you're here, but clearly you want to preserve your marriage, your relationship. So what are your goals around that? It's really important to clarify expectations, make sure they're realistic. There are not any quick and easy fixes. You'd be surprised how many times guys come in, they think they're 1, 2, 3 sessions, boom, I've got what I needed, I'm out of here. Doesn't work like that. And really importantly, make it clear that this is a partnership. Remember, a lot of guys struggle with the fear of losing control. This is about a partnership, and he's actually the one in charge of making things happen. We're going to work on this stuff together, but you're going to decide what changes you ultimately make. So empowering that agency. And it is important to address masculine stereotypes or expectations and how that shapes not only how he sees himself, but how he engages with the world around him. And a lot of guys will actually struggle with therapy because being authentic, or how we often talk about being vulnerable, a lot of guys see that being as fundamentally incompatible with traditional masculinity. Men see being authentic as a sign of weakness. We have to flip that narrative. It's being authentic as a sign of strength rather than a weakness. And so you can have open discussions about social pressures a guy might feel and how traditional norms may actually conflict with his emotional needs. And again, reframing being real and authentic as being a strength. It's hard to overemphasize that. I actually talk about the positive aspects of masculinity or being a guy. Very often, especially in the more public discourse around men and masculinity, it's often on the toxic aspects. And a lot of guys feel shame about that. And it's like, that's not me, but I'm a man. So a lot of people presume that reflects something about me. So I turn it around. Well, what are the important parts of your own masculine identity that you actually like, that you want to preserve, that you want to work on? So we do that. This may seem simple, but it's actually really important. Try to avoid using, a low voice, soft, emotional. Guys, for a lot of guys hate that. It makes them feel like a child. They really, really don't like it. It's uncomfortable. It's threatening. And so if you just talk normal and just make it more of a typical conversation, if you will, that's a lot more settling. And once a strong partnership or alliance is developed, you can then strategically use the tone of your voice when it's time to dig deeper. They know you're serious. And it's like, Bob, tell me about that. And it's like, okay, things are getting deeper right now. And you're using your voice to illustrate that. Don't be afraid to be direct. I work from a psychodynamic perspective, but if you take video of me doing therapy, particularly with guys, you're not often going to see me being very adherent to any dynamic manual. And one of those things is that I tend to be rather action orientated to match what a lot of guys' tendencies are. And that includes being direct. So we're getting down to fixing stuff. And that helps instill confidence in them, actually. And it's like, oh, this doc knows what he's doing. And very importantly, it makes those pauses and silences when used a lot more effective. It's really important not to be pushy or controlling. At the end of the day, the client is responsible for setting the agenda. You're working with them. You're not telling them what to do. Self-disclosure is also an important thing and can be really useful in strengthening the partnership. And for a lot of guys, it's a sign of trust. They experience, and I put this in quotes because they actually say this quite often, I need to know you're a real human being. Don't be this human-like subject behind a veil of silence and neutrality. They want to know that they're working with a real human being who cares about them. It models openness, but be very careful how you use it. Use it very judiciously. Don't overdo it. Subtle is safer. This one I thought was really good. Matt Ganucci, who is a member of SBR, has done some really interesting work on this topic of using metaphors. And I found it really resonates with me because in my work with men, I use metaphors a lot. a lot of it can be helpful for our guys because it provides an indirect yet accessible way for them to experience or think about their experiences and emotions and challenges in a different way. And so you can bypass these barriers by using these non-threatening and more relatable ways to engage in conversation about whatever dynamics at play. And when that conversation's happened, then you can start being more specific about what's going on. So it's a good sort of backdoor to working with men. And when we're talking about feelings, men therapy, we have to acknowledge the fact that a lot of men perceive therapy as a place where they'll be expected to be emotional. Oh, you're just gonna make me cry, or I'm supposed to cry and be all soft, and they don't really feel ready or willing or equipped to do what they think they're going to be asked to do. So I give a little bit introduction into masculine socialization to kind of get at that issue. So I say something like this, many men were raised in such a way, and sometimes I'll just include myself because this refers to me too, in such a way that they felt it was really inappropriate to express emotions, especially the kind that might make them look soft or weak. But the fact is, for you to fix these problems, you're going to have to learn a lot more about your emotions. And here's a bit of a metaphor. Think of your emotions as data. They tell you something about yourself. And the more you understand your feelings, in other words, the data that they carry, the more you understand yourself. And then here's this hope-inspiring thing. The good news is by working together, it's totally doable, and you'll be stronger for this. So it's not repairing something that's broken. That's not how you're framing it, is you'll be stronger for it. So you also want to try to normalize emotion expression. And it's a normal and healthy aspect of human experience to have a wide range of feelings that you feel and communicate. Guys tend to put those away, suppress them, ignore them. Of course, that leads to all sorts of difficulties. And so you want to normalize these feelings, especially the challenging ones like sadness, grief, shame, so that it reduces the shame about them feeling it in session. And tell them, this is helping build an emotional intelligence. It's framing it as a new skill set. And so, different ways to do this: psychoeducation about how to explain emotions. Use of silence in certain moments can give them the space to feel. And it's a space that they may feel they don't have anywhere else in their life. And reinforcing and validating those experiential moments, however small they may be. And undoubtedly, we'll experience guys that just don't seem to have much of an in with regard to their inner affective lives. And so, in a very simplistic way, I tried to put down, three sort of core aspects of a strategy working with these kind of guys. So the first part, putting into words the chain of events that makes up a difficult situation, and then reflecting on their appraisal of that situation, and then thinking about the affective responses and how the client deals with that. So if I break that down a little bit, so the first part, you want to ask the client about his actual life. What's gone wrong? You're creating a conversation about this, and you're focusing on sort of the concrete details, the concrete elements of a situation that somebody brings up as difficult or troubling or wrong. It could be trouble at home, an incident with a colleague. And so really you're creating an elementary narrative about this difficulty. And then you help them try to articulate what's painful or touching about the event. This is meant to provoke kind of a normative reflection about the situation. What's wrong about this and why? And so you're shifting now from sort of a factual chain of events to something more reflective, their subjective evaluation and their reactions. And then talking about their experience of distress. So reflecting on what they actually felt. And very often it could be about the physical feelings that they have. And you try to pair it with affective experiences. So you may actually have to name these reactions for them. Oh, that's fear, that's sadness, as an example. And talk about how those are normal reactions, how it makes sense. And so you try to integrate a broader autobiographical event or account of events. And so in a way, you're building a life story for them, helping them build a life story so that they understand their own experience in mind better. So I realize that I have seriously underestimated how much time I needed for this. I'm happy to share my slides, by the way, so don't worry. So I thought at this last part, which I will not get through, but touch on a couple of things, just thinking about different kind of specific strategies that could be useful when working with men. The one thing I do want to emphasize is that it is important for us as the therapist to have a consistent conceptual framework to approach the work with the client, something that helps us understand the work that we're doing. But this doesn't mean that we rigidly adhere to techniques of one model. In order to be optimally responsive to the needs of our client, we need to be flexible and adaptive, be able to integrate different therapeutic strategies that best serve the needs of the client. And how we select and use these are guided by the objectives of therapy and informed by the treatment framework that we carry in our mind. One of the big things, and this is what a lot of guys, they feel if they've come to therapy, somehow it represents them being less than. I'm less than others. I've lost some of my manhood, if you will. I'm weak, I'm broken, fix me. But it makes them feel incredibly uncomfortable being in that place. So what you want to try to do, emphasize their personal responsibility, recognize that they have a critical role in taking control and shaping their experiences and responses to different life events, and empowering them to take active steps toward growth. And that's a big thing in how to kind of frame therapy. This is an opportunity for growth. This doesn't necessarily mean fixing something that's broken or making you less weak. And related to this is building an awareness of choice and emphasizing the power of the choice that they have to shape their thoughts and behaviors. Again, empowering them to feel in control and reducing the sense of helplessness that a lot have. I recognize that we are now past the hour. Give me a thumbs up whether I should end right now or continue. How are we for time?
Continue, John.
Continue? Okay. Tell me to shut up when you need to. Oh, here we go. Again, a lot of men, it's like they have some challenges with digging into their affective lives, I had mentioned previously. So focusing on the here and now is perhaps for some guys a more useful way of getting them to be more reflective, but it's on their immediate thoughts and their feelings and not uncommonly on body sensations. And it allows them to feel less defensive because it's just happening right now. What's going on for you right now? And it helps create an opportunity for them to develop narratives about experiences. You start with momentary experiences in the now, but then you can work that in toward creating narratives about past experiences and difficulties that they've had. Body awareness techniques can be really good as as I mentioned, somatic expressions of distress are common in a lot of guys. You know, they pack their emotions away, pack them away, but they don't go anywhere. They find another way out, and through their body is one of the common ways. And so some men might actually find it easier to access their emotions through physical sensations rather than strictly verbal exploration. So that's why body awareness can help bridge that gap. So you can use, you know, what might this tightness in your chest be trying to tell you? And so that is a really simple way to get them engaged in thinking about their body and then what might be the meaning of those somatic experiences. I've got, you know, addressing unfinished business, focusing on unresolved experiences, and it allows them to, you know, address stuff that for a lot of people have been just tucked away for decades. And trying to reflect. Oh, I'm going to just hop over here because here's an example of how to get to that in a helpful way. And so for those of you who might not be so familiar with, is that it involves addressing an empty chair, literally an empty chair, as though if it's another person or part of oneself or even a situation that the person needs to confront. And it provides a safe way for a lot of men to sort of, you know, externalize part of those feelings of themselves that they feel that maybe they needed to disavow and process the feelings around it. And there's different ways to use it, and I won't go through all of it now, but it is a technique that you could contemplate using with some men when they're sort of challenged to address difficult aspects of their mind and past. This is really interesting because it really connects well with the challenges that masculine socialization creates for a lot of guys, these polarities and you know, such as the tough and a vulnerable side of men, and the contrast between societal expectations of masculinity and many men's authentic desires around emotions and connectivity with others. And so you can play around with the polarities that men are experiencing, say, as the protector versus the nurturer role that they have. So that can be very helpful. Creative expression. So sometimes a verbal expression is really, really challenging. You might look for other ways, creative outlets for men to explore their experiences in their minds. And so it might be drawing or mapping out, even perhaps even physically manifesting what they're feeling. Just a different way. Maybe it's writing a letter to themselves or others. You know, I put in here, doesn't have to be sent, but it's just a different way to be expressive. I brought this up earlier about the lack of purpose and meaning that a lot of men experience. So it's really important then to think about how you incorporate meaning making into therapy, the existential concerns they have about them and their lives. So thinking about, you know, what does success mean? You know, it's an easy one for guys to think about success. It'll very often start with material success, but of course, it's not necessarily what we're getting at. Thinking about legacy and how even something simple like journaling can be helpful for them engaging in that kind of process. Behavioral activation, I'm not going to go through what that is. I'm sure you're all familiar with it, but it's a good way to help guys be action orientated toward achieving some goals. And I talked to them about getting some wins under their belt, some small victories, these little steps. And again, I use metaphors here, and really a metaphor for therapy. And it's like, I think of a mountain. Here you are, you're at base camp and you want to climb to the top of that mountain. No one ever leaps to the top of the mountain. It's literally one small step in front of the other. And each step in and of themselves might not feel like very much. But if you keep at it, after a while, you look down, it's like, wow, I have really come a long way. So it's the accumulation of all these little steps. So that's what I try to get guys thinking about when we might even be talking about these simple aspects with regard to behavioral activation. But really, it's an analogy for therapy in and of itself. Anger and aggression, big issue for guys. We want to help men understand and manage anger and aggression. We want to try to get them to be reflective about the triggers for their anger, understanding what underlies it, and how to engage in alternate responses. The guys are often socialized to express their distress through anger, which of course leads to a lot of other problems. So addressing their anger and aggression helps foster more self-awareness and developing healthier coping strategies. We want to normalize anger as a valid emotion, but it's also very important to distinguish it from aggression. We want to explore things like fear or sadness that is often masked by the anger, and importantly, teach them different techniques to deal with anger, and very often when they're experiencing it in the moment, so they don't act on it. All right, I've come to the end. I'm sorry for the the going over time. Here's just a few summary points that I know there's a lot there, but here's a few takeaways. There's a common narrative that men don't do therapy, but a lot of men are actually interested in therapy and in fact want therapy. And we're seeing this play out, and perhaps you're seeing it in your own practice. And while it's often espoused that some special approach, therapeutic approach model is needed, therapy with men is, by and large, not fundamentally different than what you're used to. However, there are some special considerations about how to work with men better to keep them engaged and hopefully extract maximum benefit from it. And finally, as with any client, therapeutic flexibility is important. And in that sense, there may be certain strategies that could be particularly helpful for some men. It's just useful to have in your toolkit, if you will. So I'll end it there. I know we're out of time, so there's probably not much, if any, time to go over this, but even just thinking, I was hoping to have a conversation, hearing from others what they found helpful for working in therapy, but perhaps that's for another time. So stop sharing there, and thank you again for tolerating my lack of adherence to the time.
Thank you, John. Is it okay for you if we still take some of
Yes, it's okay.
couple of questions? Because I would like to move the discussion and to give the opportunity for our colleagues to ask some questions. What did you find interesting? What would you like to add or to explore further?
I'd love to hear what people might have found helpful in their own practices working with men. Much of what I shared is my own personal experience, because the fact is that there's actually very, very little out there as far as research that we can use to help inform our practices. So the more we share with each other, the more we can think about how to approach this, not only from an academic research perspective, but very importantly, clinically.
There is a question by Denise Duffy. Please go ahead.
A comment, actually. Thank you very much. I think it was a very, very good idea to have this webinar, because the mere fact of having it is sort of pointing out the fact of how little we speak about this. I think that two issues are especially necessary for us to pay attention to in relation to men. And one is perinatal loss, because this is an issue which has taken great attention all over the world, but mainly based on women's or mothers' reactions, and men are sort of not authorized to have their own mourning, but to care for the wife. And the second is men who are being unfairly accused of domestic or gender violence, because in many countries, in mine, for example, the law gives right to a woman to say, and that is enough, and the man has to prove. And so many men are unfairly accused and even put to jail, and suicide is often occurring when they are not really guilty. And although some attempts have been made, and well, not partially successful, to deal with the loneliness and desperation and impotence of these men, I think it is a matter that at least I have not found any research on. And I think that we need to go deep into this, because we're not only citizens, we're therapists and researchers. We get sort of embedded in the common wave of, oh, how terrible, and this assumption that they are born bad. And we lack a lot of understanding and research on their feelings and how to help. Thank you.
Two very important, good points to bring up, Denise. Thanks for sharing that. And you know, that part about being born bad, that reminds me of a number of younger clients that I've had, young men who have been raised in a single family household by their mother, who had exited a very bad relationship. And so the mother, in these instances that I have in my mind, is that based on her experience with her ex-husband, men are bad, men are bad. And this is the messaging over and over. And these young men end up developing this really entrenched sense of shame about being born a boy, a man, a male. And so in a way, it's exactly what you're saying, feeling like they're born bad. I'm a bad person because I'm a man.
Thank you. Any other questions, comments?
Та у нас є запитання в чаті, і воно лунає так: як розташувати клієнта до себе і прибрати його закритість?
Well, a couple of things that I do, and I get back to that action-oriented part that I was talking about earlier. It's like you're here and you're here for a reason. Even if it feels like you were coerced to be here, you still came here. Why? What's underneath that? What's the motivation? What do you hope to get out of this to make it a useful experience for you? And so you're getting them to talk about what they can derive in a positive way from this. And then it's like, we're going to work on this together. I'm going to help you. There's that partnership. But then in this partnership, you're the one that steers the boat. And that's where it's like, it's really important to put the agency in their hand and framing it as a way that they're in a position to capitalize on an opportunity for growth, developing a new skill set. And, you know, I may sound like a broken record, but not addressing them as a way that they feel broken or weak and that I need to fix them somehow, because that's just not going to work. So it's a partnership. They're in control. They're here to grow, to be a better version of themselves.
Thank you. Now,
Ще є питання.
there are two
А якщо в
questions.
нас є час для цього. Так, питання лунає так: як говорити з чоловіком про стосунки із батьком? Чи є певні специфічні проблеми тут?
Yes, one of the things that a lot of guys will talk about in one way or another, and sometimes it's a very explicit, is the lack of mentorship in life. And it often comes up in the context of a guy saying, I didn't have any model or any good role models in life to show me what being a good man means. And not surprisingly, this will turn to who the most obvious influential male role model ought to be in a man's life, their father. And so when you talk about the absence of mentorship and role models, it's a segue into conversations about father and the relationship, or perhaps a lack of relationship, that they had. And it's not to absolve a person of their own responsibility for their experiences, but when we're talking about parents, in many ways, we're talking about how parents have failed their children. You know, let's be honest with it. And so when we put it that way, then it's not somehow a conversation about somehow ways that they failed in childhood, but how they were failed by others around them.
And now I will also exercise my power as the moderator and give some voice to men, actually. So Europe first, then Nicolas, and then Juan at the end.
Добрий вечір. Дуже дякую за переклад, в першу чергу, також за цікаву лекцію. І в мене слідуюче питання. Наразі дуже багато військових в Україні, які повертаються з війни, впадають в пастку залежності, тобто починають вживати алкоголь, наркотики. Може, попрошу переклад, бо то буде не відразу все вам.
У нас синхронний переклад, тому ви можете говорити.
Ага, дякую. І от люди, які звертаються, тобто військові, і звертаються за допомогою, як правило, багато хто з них попадають в реабілітаційні центри, тобто в осередки, серед чоловіків, які не мають до війни і взагалі не є військовообов'язані, вони не мають ніякого відношення. І от питання, можливо, Джон поділиться, власне, як краще працювати, щоб військові були окремо для них щось будувати, чи їм та програма, яка підходить в реабілітаційних центрах, може бути і підходити також разом зі всіма? Дякую.
That's really interesting thing to think about. And based on the work that I've done with soldiers here, there's something very specific to the camaraderie that they've developed with other soldiers, either soldiers that they know and fought with, or just knowing somebody else is a soldier, because it's like, you understand, if you've never been in combat, you cannot understand what I went through and what I'm going through. So the rehabilitation that you're talking about, certainly at the beginning, I think it's actually really important for the soldiers to be with one another when they come back, to be able to work through collectively the challenges that they went through. And substance misuse, it's rampant. Why? Because it's a way to numb. It's a way to forget. It's a way to distance themselves from pain. And let's be honest, from an acute perspective, it works. You know, whether it's alcohol or some other drug, they take it and they numb. It does the job, but of course, more and more problems occur because of that. So it's really important to help men, not feel shame about using the substances in the first place, but it's to help them understand it's actually their attempt to cope. There's always some sort of pain, and with soldiers, it's physical and psychological. There's always some sort of pain underneath, and they're trying to get away from it. They don't know how, so they drink or smoke or whatever. Later on, I could see there being value to integrating men with combat experience and men who are part of normal civilian life. But I think that's a thing after guys have been able to really unpack their experiences, because every single man who comes back from the front line is changed. He's fundamentally changed. Things that they see, things that they might have to do, you can't undo any of that. It's always with them. And like I said at the beginning, it's so important for them to be with others so that they don't feel so alone and isolated, and perhaps even feeling judged by society for what they went through.
Thank you, Nikolai.
Thank you, John, for your presentation. I have two questions. The first one is in the line of mentorship. I work accompanying psychology students with self-knowledge workshops of psychologist persona, and in personalized mentoring for psychology students. And some men that I work with tend to see anger as something bad per se, for fear of the reactions. And they have several issues with their mental health and emotional regulation. And I wonder how these issues that you have presented us are worked through in the training of male psychologists. Like, how do we train or work with men that are going to be psychologists?
That's a good question. Yeah, honestly, I don't have an answer for you. But if we just think about it on the spot, I think when we're talking about trainees, so whether they're male or female, talking about when working with men, anger is a common issue that will be confronted. And if you are a male trainee, this also reflects upon your own experience of yourself. So I think that's how to bring it in, rather than just say we're going to work with male trainees. So you make it about how to be cognizant of issues that male clients will present with, how to work with that, but then also be reflective of yourself as the help provider, if you're a male, of what that's like. And the big thing with anger for guys is normalizing the fact that anger is an emotion we all feel. And it's not the feeling of anger that's bad, so to speak. It's how you react to that anger. So being able to separate that is, as simple as that sound, that's fundamentally important and very helpful for men. Just because I feel angry doesn't mean I'm a bad person. But how I react to my anger can lead to bad consequences, if you will. And that's where learning different strategies about how to regulate, moderate that anger and adjust more adaptively, that's the skill set. It's like, oh, you're learning new skills. And so guys like to learn skills. And so that's a helpful way to get at it.
Mm-hmm. Thank you. And the other question was from working with couples, I wonder, how do you work with these psychological issues from men, but not from intervention, but from a psychoeducational approach to work with couples? How do you, how can you work with their, I don't know how to say, adherence or adhesion to the treatment from a psychoeducational approach?
Well, I think when you're talking about a psychoeducational approach when working with couples, one of the very important things, and maybe it's just acknowledging what's obvious, but very often it's important to point out the obvious, is that by and large, men and women have sort of different skill sets when it comes to communication, affective communication, understanding their own interior world, and how they share that with other people in their lives. And what we know about ourselves, it may be limited or maybe more robust, we can assume that that's what other people do. And so being able to understand, it's like, what I know or what I don't know about my thoughts and feelings and how I do or don't communicate isn't necessarily how my partner does it. I can't expect the same of them. And I try to invoke the aspect of mentalization or reflective functioning in this end and really breaking it down. And it's like it's such a critical aspect for developing good interpersonal relationships. On the one hand, we want to understand ourselves from the inside out. What are our thoughts and feelings and wishes and fears that shape our behavior? But then for the other person, we only know what we see. And so if that other person doesn't share what's going on in their mind, they don't invite their other person into their mind, they're left with making assumptions. Sometimes they may be right, but very often they're wrong. And so you owe it to the other person in the partnership to do that, to invite them into your world so that they can understand you better, so that they don't make assumptions that often lead to conflict.
Thank you.
Thank you. And Juan.
Well, first of all, thank you so much, John, for your presentation. I have many questions and things I would like to ask you about, but I'm only going to make you two questions specifically.
Okay.
One of them, yes, one of them is mainly regarding if we can actually trust self-report measures, for example, in depression screenings in men, or should we assume that they are getting lower scores than what they're actually getting, mainly because of what you were saying before about the social constructs of what is expected and what men are allowed to feel. So if we can actually trust these self-report measures. And the second question is, what effect do you think is having on men's mental health, all the social media content that have been popping up lately, mainly regarding about empowering men and sort of getting back their lost masculinity and splitting men into male or beta. This has sort of been popping up on social media, and I wanted to know what was your thoughts on this.
Well, for the first one, I actually think self-report scales are quite fine for men to use because they're engaging, whether it's a piece of paper or on an iPad. Even though, in a study, they know their data is being collected, there's a sense of privacy and anonymity that's associated with them filling it out. By and large, they feel it's okay to be honest because they're not actually speaking to another person. So I don't see any reason why not. As an example, we actually use the PHQ-9 on our Heads Up Guys site. We've had more than 500,000 men fill this out. 75% of them are screening with probable depression. So it's not that men aren't willing to share by use of self-report. So I think it's fine. For the other one, I wish I had an answer. It's an absolute shit show out there. It's, with social media is not inherently a bad thing. It can have good purposes. The sad reality is that it's often used for negative purposes. And we're seeing more and more of that. I'm in Canada, so I'm seeing some of the conversations and dialogues that's happening in the United States right now with the, it was leading up to their election and afterward, and the polarities that exist in society then. And I think a part of it is that many men, I'll bring up a couple of the issues that I spoke about, they're lonely, they're looking for connection somehow, and they're also lacking a sense of purpose or meaning in their life, often lacking mentorship. They're lacking role models. And so a lot of, I think, especially younger men, and they're almost in a desperate situation to feel like they belong to something, and they're drawn toward people who appear very strong and confident and almost domineering. And it's like, that's what I've been lacking. I've been lacking a sense of strength within my own mind. So I'm going to use that person's. I'm going to attach myself and sort of vicariously feel stronger because of that attachment, if you will. That's as clever as I could be in the moment, because I really don't have any good answers about what's going on or certainly how to fix it.
Thank you very much.
Thank you. And I think that even though we are deeply in the Canadian spirit, we have to move this webinar to an end, because we are half an hour after the time. But it was a great pleasure. Thank you for all the questions, very intriguing and also active discussion. It was very good to hear also from men from Ukraine. Thank you for active participation in this webinar. And perhaps some few words at the end from Oli. Oli, would you like to summarize our discussion and our webinar? Thank you.
Well, I'm not going to summarize, but I had technical problems. I'm really sorry that I missed a big chunk of this. So thank you. Thank you to John Ogrodniczuk for coming to this webinar. It's our way to stand with the Ukrainian psychotherapists, as we continuously do for now a number of months and years already, and we continuously do so. And I really appreciate everyone being here and asking all these questions. And I know this will have an impact on everyone's practice and how we treat our clients, in particular men. I wish everyone a nice evening and wherever you are. Thank you.
Thank you very much. And we do encourage everyone once again to participate in the survey that will be sent out. It's a survey that is done in cooperation between you and the Society for Psychotherapy Research. And so please, if you enjoy this initiative, support it back with your participation, because this is something that we need also to feel included, and to also include you in not only webinar activities, but also in the scientific research part. So, Oraya, anything to add, or?
The only thing is the deadline for submitting to SPR is approaching closely. And we invited therapists from the Ukrainian committee from the Ukrainian community to submit posters. And I'm waiting for a response from Felicitas. I sent her already an email. I'm sure it's going to be okay. And I will send an email. Hopefully she will respond tomorrow. I already wrote her a few days ago. So that we'll be very happy for you to present some posters in the Krakow conference. That would be great.
Yes, thank you. Thank you for mentioning that also, Oraya. Yes. So anyway, it was I think, beautiful, active webinar. Thank you, John, once again for being.
Yes. It was terrific, and I'll just add that we rarely see papers on this topic, so that says something. So I also took a lot of notes. Thank you.
You're welcome.
Great thanks also to Katarina, who I have to underline each time is doing a wonderful job in helping us to bring all of you together. So, and to Juan also, who is new in this role, but who will support us in the future, I hope, actively. So anyone who was not able to be here today, please look at the chat. There are links to the recording, so you can actually be a part of the whole webinar, even if you were not here. So distribute the link and use it. Thank you kindly. Have a good night, and all the best for all our friends.
Thanks, everyone. Take care.
Дякую.